Did you know that 1 in 8 men will develop prostate cancer at some point in their lives? Surprisingly, many men never spot the early warning signs. Signs so subtle, they're often dismissed as minor discomforts or simple inconveniences. Today, you'll learn about 10 crucial symptoms that could genuinely save a life. And by the end, you'll receive a practical checklist to easily keep track of each one, either for yourself or someone you care about. Before we begin, think of the men closest to you, your father, husband, brother, partner, or even a close friend. Prostate cancer remains the second most common cancer in men globally. According to the American Cancer Society, about 1 in 8 men will face it eventually. The biggest challenge is that prostate cancer can often grow silently for years, showing only faint signs that are easy to overlook. But here's the encouraging part. When caught early, prostate cancer can be very treatable. Sometimes, just recognizing one subtle symptom can mean the difference between a manageable condition and a more threatening scenario. I'm going to walk you through 10 warning signs that are frequently ignored or misread. We'll talk about why these signs happen, who might be in greater danger, and how you can act right now to protect yourself or loved ones. And don't forget, at the very end, there's a special checklist waiting for you, so you can put this knowledge into immediate practice. Warning sign 1: painful or burning urination. Let's start with a symptom that may appear mild, but is often a serious clue: a persistent burning or stinging sensation when you urinate. We're not talking about the occasional mild twinge from dehydration or spicy food. This is a sharper, recurring pain, sometimes coupled with a powerful urge to go, but only a small amount of urine actually coming out. Why might this happen? Urethral constriction. As the prostate enlarges, whether due to a benign process or malignant cells, it can press on the urethra, creating inflammation and pain. Secondary infections. When your bladder doesn't fully empty, any leftover urine can help bacteria thrive, leading to urinary tract infections. Antibiotics might bring temporary relief, but if the real cause is a growing tumor, the burning can return. Lifestyle habits. Smoking, heavy alcohol use, and diets high in inflammatory foods may worsen urinary discomfort and highlight any underlying prostate issues. A story that illustrates this involves John, age 52, who assumed his morning burning sensation was caused by coffee. For weeks, he cut down on caffeine. Still no improvement. Eventually, he saw a specialist who discovered early-stage prostate cancer. If this kind of pain persists or keeps coming back, it's vital to consult a medical professional. A PSA, prostate-specific antigen, blood test, or a digital rectal exam can help clarify if there's a more serious underlying issue. Warning sign 2: frequent nighttime urination nocturia. Moving on, let's talk about those late-night trips to the bathroom. Waking up once in a while is usually no big deal. But if you find yourself stumbling out of bed multiple times every night, that could be a significant concern. This frequent nocturia can disrupt your sleep, leave you exhausted during the day, and may indicate your prostate is pushing on your bladder more than it should. What's happening here? Bladder compression. A tumor or enlarged prostate can reduce how much urine the bladder can hold, so you feel the urge to go more often, even if there's not much urine to pass. Sleep disturbance. Chronic interruptions to your sleep lead to irritability, trouble focusing, and a generally weakened immune system. Lifestyle consequences. Men dealing with nocturia might avoid fluids in the evening or skip social gatherings to dodge nighttime accidents or fatigue. Mark, 58, was convinced it was just age until he realized he was waking up 3 or 4 times each night. Cutting back on water didn't help. Finally, a doctor's visit revealed a growth in his prostate. If you're up multiple times nightly, keep a bladder diary for a week. Note how often you go and estimate how much you pass. That record can give your doctor valuable insight. So far, we've touched on burning urination and frequent nighttime trips to the bathroom. Both can seem minor but could hide something more serious. Warning sign 3: blood in the urine, hematuria. Seeing blood in your urine can be startling, to say the least. Whether it's bright red, pinkish, or only detectable through lab tests. Hematuria is always worth investigating. Kidney stones or serious infections can also cause it, but if you're over 50, the prostate is a prime suspect. Why does blood appear? Tumor growth. An enlarging prostate tumor can erode surrounding tissues, including blood vessels, allowing blood to seep into the urinary tract. Intermittent occurrence. Sometimes blood appears briefly, then vanishes, fooling people into believing the issue is resolved. Emotional jolt. While alarming, spotting blood in your urine can prompt early detection of underlying prostate issues, which is actually a silver lining. Stephen, 55, noticed his urine had a pinkish hue after long walks. He brushed it off as dehydration, but a persistent tint led him to a specialist. A scan found a small tumor near his bladder neck. If you ever see blood in your urine immediately or microscopically, consult a doctor for tests like cystoscopy or CT scans. Warning sign 4. Pain in the back, hips, or legs. Do you have a nagging ache in your lower back, hips, or thighs that no amount of stretching or over-the-counter medication can fix? Many men chalk it up to age or an old sports injury, but advanced prostate cancer often spreads to bones in these areas. How it happens? Bone metastasis. Prostate cancer cells can travel to the spine, pelvis, or femur, causing deep, persistent pain that might worsen at night. Nerve compression. If the tumor presses against nerves in the spinal column, you could experience numbness, tingling, or even weakness in your legs. Commonly misread as sciatica. Delayed diagnosis. Chronic back pain is so prevalent that people tend to manage it with painkillers or physical therapy, missing a potential underlying malignancy. Sam, 62, spent months in physical therapy before discovering via MRI that his prostate cancer had already migrated to his pelvic bone. If your pain lingers or intensifies, especially at rest, it's time to push for imaging tests to ensure something more serious isn't at play. Warning sign 5. Sudden weight loss. Losing weight without dieting or working out harder might initially feel like an unexpected gift. However, when pounds melt away with no logical explanation, it often signals a deeper issue, including the possibility of cancer. Key factors. High energy consumption. Cancer cells are demanding and can deprive healthy cells of nutrients, leading to muscle waste and overall weight reduction. Hormonal imbalance. Prostate cancer can alter hormone levels that influence appetite and metabolism, making you eat less or feel full faster. Mistaken relief. Men sometimes enjoy the apparent benefit of dropping weight, only realizing something is amiss when severe fatigue and weakness set in. Walter, 50, watched his waistline shrink but soon felt constantly drained. Tests later confirmed advanced prostate cancer that had already interfered with his normal metabolic processes. Pay attention if you lose more than 5% of your usual weight in a half-year period without actively trying. That's often a big red flag to see a specialist. We've now covered 5 signs: painful urination, repeated nighttime bathroom trips, blood in the urine, nagging lower body pain, and sudden weight loss. Each could be brushed aside as part of daily life, but they might indicate an underlying prostate issue. Warning sign 6. Pain in the rectum. A lingering ache or constant pressure in the rectal area can easily be blamed on hemorrhoids or constipation. However, the prostate's close proximity to the rectum means significant swelling or a tumor can press on the rectal wall. Signs to watch for. Persistent discomfort. You might sense a constant urge to have a bowel movement or feel you can't fully empty. Incorrect self-diagnosis. Many men spend months using hemorrhoid creams and supplements, unaware that the problem could be an enlarged or cancerous prostate. Associated symptoms. Some also see narrower stools, rectal bleeding, or bloating, which should prompt further investigation. Greg, 54, tried multiple hemorrhoid treatments with no success. A more thorough exam revealed a sizable tumor compressing his rectum. If rectal pain doesn't improve within a couple of weeks or gets worse, consider a digital rectal exam, PSA test, or an ultrasound of the prostate. Warning sign 7. Pain while sitting. Do you notice discomfort or pain specifically when you sit down, even on comfortable chairs? This could be more than just poor posture. When the prostate is enlarged or cancerous, it can radiate pain throughout the pelvic region, and prolonged sitting can intensify this pressure. What might be going on? Pelvic floor irritation. Swelling in the prostate can aggravate nearby nerves and muscles, causing a dull ache or sharp pain in the groin or lower back. Occupational hazards. Truck drivers, office workers, and anyone seated for long periods might blame their chair or sitting posture without suspecting the prostate. Quality of life impact. Chronic pelvic pain can make everyday tasks, like working at a desk or traveling, uncomfortable, leading to stress and anxiety over time. Antonio, 45, spent a small fortune on seat cushions and ergonomic chairs, only to learn from a medical exam that his real issue was a prostate tumor in its early stages. If your sitting pain won't go away, ask a healthcare professional about checking your prostate health. Warning sign 8. Difficulty urinating, weak stream or retention. Have you observed a weaker urine stream, trouble starting the flow, or a feeling that your bladder isn't emptying fully? These challenges might be embarrassing to discuss, but they can point straight to a growing prostate problem. Causes include urethral narrowing. A tumor or enlarged gland can constrict the urethra, forcing you to strain just to start or maintain a steady flow. Bladder retention. If the bladder doesn't empty, leftover urine can lead to infections or other complications, such as bladder stones or kidney strain. Behavioral shifts. Some men reduce fluid intake to avoid repeated attempts in the bathroom, risking dehydration and further health issues. Carl, 60, joked about his rusty pipes until a serious incident left him nearly unable to urinate. Doctors discovered a sizable tumor narrowing his urethra. If you notice a noticeably weaker stream or trouble fully emptying your bladder, consult a doctor about a PSA test or imaging to see if the prostate is the root cause. Warning sign 9. Loss of bladder control. Urinary incontinence, ranging from slight leaks to sudden uncontrollable urges, can drastically impact your day-to-day life. While age or muscle weakness sometimes explains it, a compromised prostate can also disrupt the nerves and muscles that govern urination. How it happens? Nerve disruption. Cancers or treatments like radiation and surgery can damage nerve pathways. Lifestyle fallout. Many men avoid travel, exercise, or social gatherings out of fear of accidents, fostering isolation or even depression. Variations. Some men only leak when coughing, while others have frequent, urgent dashes to the toilet they can't control. Michael, 64, gave up tennis because of embarrassing leaks mid-game. Eventually, a doctor identified an enlarged, cancerous prostate pressing on his pelvic floor structures. If you're noticing incontinence without a clear explanation, a thorough exam can help identify the cause before it progresses. Warning sign 10. Painful ejaculation. An act meant to be pleasurable and intimate becoming sharp, throbbing, or downright painful is a strong indicator that something could be wrong inside the prostate. Since the prostate produces seminal fluid, any abnormality in the gland can directly affect ejaculation. Common reasons. Prostate's role in semen. Malignancies or inflamed tissues within the prostate can cause painful contractions during climax. Psychological burden. Men might shy away from sexual activity to avoid pain, which can lead to relationship strain and emotional turmoil. Differentiation. Conditions like prostatitis, benign hyperplasia, or cancer can all trigger painful ejaculation. Medical tests are the only way to know for sure. Jacob, 40, attributed his pain to stress or exhaustion until it became so severe he finally sought medical advice. A small but critical tumor was identified, one that might have been missed for longer had he ignored the symptom. Don't let pride or embarrassment keep you from asking questions. Painful ejaculation can signal a serious underlying issue. Recap of the 10 signs. Painful or burning urination. Frequent nighttime urination. Blood in the urine. Persistent back, hip, or leg pain. sudden weight loss, rectal pain or pressure, pain while sitting, difficulty urinating, weak stream or retention, loss of bladder control, painful ejaculation. Even if just one of these sounds familiar, don't ignore it. It could be a clear nudge that your body needs a checkup. Why prostate cancer occurs and who's at greater risk. Prostate cancer generally starts when cells in this gland mutate, multiplying faster than normal. Eventually, they form a tumor that can remain localized or spread to other areas like bones or lymph nodes. Factors that raise risk: genetics and family history. Having a father or brother with prostate cancer can double or triple your own risk. BRCA1/BRCA2 gene mutations can also lead to more aggressive cases. Diet and lifestyle. High-fat, processed foods and sugary drinks can foster systemic inflammation. Meanwhile, diets richer in fruits, vegetables, and whole grains may have protective effects. Obesity. Being significantly overweight often correlates with more aggressive or recurrent prostate tumors, partly due to hormone imbalances in fatty tissues. Ethnic background. African American men have a notably higher incidence and mortality rate, partly due to genetics and disparities in healthcare access. Hormonal factors. Elevated testosterone levels and other androgens can accelerate abnormal cell growth in the prostate. Prevention and early detection tips. No method is foolproof, but several approaches can drastically cut the risk or help spot potential issues early on. Healthy, balanced diet. Prioritize vegetables like broccoli or tomatoes, which contain lycopene, fruits, whole grains, and lean proteins. Reduce intake of processed meats and sugary beverages. Regular exercise. Activities like brisk walks, cycling, or moderate gym sessions help maintain a healthy weight and support better hormonal balance. Weight management. Losing 5 to 10% of body fat if you're overweight can lower the chance of aggressive tumors, and it's beneficial for overall health. Routine screenings. Men at average risk might consider starting PSA tests and digital rectal exams around age 50. If you have a family history, talk with your doctor about beginning earlier, such as 40 or 45. Reduce harmful exposures. Limit excessive alcohol, quit smoking, and be mindful of chemical exposures in certain occupations. Recap of the 10 warning signs. Painful or burning urination. Frequent nighttime urination. Blood in the urine. Persistent back, hip, or leg pain. Sudden weight loss. Rectal pain or pressure. Pain while sitting. Difficulty urinating. Weak stream or retention. Loss of bladder control. Painful ejaculation. Each could signal that your prostate is under stress or harboring a tumor. Don't assume they're trivial or just part of normal aging. Acting quickly can expand treatment options and improve long-term outcomes. Practical checklist. As promised, here's a simple checklist you can refer to periodically or share with someone you love. Think of it as a quick way to keep tabs on potential prostate issues. Comfortable urination. Have you noticed a burning, stinging, or painful sensation repeatedly? Nighttime frequency. Are you waking up more than once or twice each night, consistently? Blood in urine. Any pinkish or red tint, or lab results showing microscopic traces of blood. Back, hips, or leg pain. Lingering aches that aren't improving with usual measures. Weight changes. Unexpected weight loss without any change in diet or exercise. Rectal discomfort. Ongoing pain, pressure, or difficulty with bowel movements. Pain while sitting. Do you feel discomfort even on comfortable surfaces? Difficulty urinating. Weak or interrupted stream, or feeling you never fully empty your bladder. Bladder control. Experiencing leaks, sudden urges, or accidents. Painful ejaculation. Do intimacy or climax come with sharp, throbbing, or lingering pain? If you or someone you know keeps noticing any of these symptoms, please consult a healthcare provider. A simple PSA blood test or digital rectal exam can rule out or confirm underlying problems before they escalate. Final thoughts. Prostate cancer might be elusive, but awareness is your best defense. Today, we explored 10 often overlooked signs, uncovered the core factors behind prostate cancer, and discussed ways to minimize risk or catch it early. If just one person, after hearing this, decides to visit a doctor sooner, then we've accomplished something truly meaningful. Share this video with friends or family who might put off checkups. Comment below if any symptom resonated with you or if you have a personal experience. Your insights could guide someone else toward prevention or early detection. Stay informed. Consider subscribing for more content on men's health, wellness, and other crucial topics. Remember, your body often whispers before it shouts. Listening to these whispers can save your life or the life of someone you dearly love. Thank you for watching, and here's to your health.